I'm Dr. Helliwell, and I'm here at Advanced Women's Health Center, and I have a wonderful new procedure to offer patients, and I'm here to demonstrate it today with one of our patients. And this is one of 3 different procedures, and this is called the vampire breast lift. And what this does, what's really unique about this, is that it uses the patient's own blood to help heal the area and promote collagen growth and to promote growth factors, and even has stem cells to achieve the goal that we're looking for. So in this case, what we're going to do is we're going to combine a combination of what's called PRP, platelet-rich plasma, from the patient's own blood, and filler, which has traditionally been injected in the face, but we're going to inject it in the cleavage area of the breast. And the purpose is to kind of lift the breast up and give it more fuller cleavage in the center. Now, our patient here, she's already had implants, and implants are great for projecting the breasts and making the breasts larger, but they generally, one of the downsides is they generally never been able to create cleavage. And so if you try to do that, if you try to put the implant in too medially, then we can run into problems where the breast doesn't look correct. So this is really nice, especially in combination with implants, because we can get the size that we want from the implant. Now we can add this part afterwards as to get the cleavage. So I'll ask my patient why she decided to do the procedure, and go from there. We'll show you.
My name's Shannon, and I chose to get the vampire breast lift because a lot of clothes I wear, I have to wear like a bra, and I don't have a lot of cleavage because when I have my implants, I just noticed like a really wide gap. And I talked about it with Dr. Helliwell, and he explained that with surgery, if I were to get a different implant, it wouldn't really give me cleavage. So I'm all for trying new things. So here we are.
And what's really great about PRP, or platelet-rich plasma, it's been around for a while, but being used in the cosmetic world, it's kind of new. It's been around in use in orthopedics, for instance, various golfers, Tiger Woods, and some other football players have had them injected in their joints, and that's helped their healing process when they have injuries. So now we're taking it the next step and doing it in the cosmetic world, because we know that the dermis, the skin, all that, these are also areas that need to be healed. But there has been no reported negative or adverse side effects from this treatment to date anywhere, because basically it is the patient's own blood. So it's nothing negative at all that can really happen from them, other than it not give the result that she's looking for. But a lot of studies have also shown that that's not true, that results are going to be there. What we're doing today is the dermal filler is going to act as like a platform in such a way you can think about it, that will help hold the PRP in place for the next 3 to 4 months. So if we just inject PRP alone, that kind of goes away quicker. But we want it to stick into the tissue for the next 3 or 4 months. So that's what the point of the dermal filler is going to do. And then over the next 3 or 4 months, her own tissue is going to grow. So it's actually going to grow in the midline and create the cleavage. So it's not an implant, it's actually her own tissue and her own breast tissue growing in the midline. And then 3 or 4 months from now, the filler will dissolve, that will be gone. And the platelet-rich plasma is already gone, but it caused the growth factors to grow the tissue already. So theoretically, it can be a permanent possible procedure. To date, they've done this patients now 18 months or more, and not had to need a second treatment. They're very happy with the results, and no second shot has been given. So we'll go ahead and get started.
How long do you think the results will show? Immediately, or should it?
You're going to see immediate results because of the filler effect, because it's plumping.
Right.
And then
so it'll be like a little swollen.
Yeah, it'll be swollen, and then you're going to see the final results like maybe about 2 months from now, because once the growth factors have caused your own tissue to grow, that's when you're going to see that effect. So, all right. So we'll start. You're fine. So one thing when we inject in this, we want to protect the implant. We finished up the right side here, and you can see the right is the treated area and the left is the untreated area. So what we're achieving here is more cleavage and more fullness at the top of the breast here by injecting in the filler plus the PRP. And this is only the beginning. This is just immediately after the injection. So this has not had time for the growth factors to start to grow and cause the breast tissue to grow. So this is only the immediate filler effect, which has a nice look, you can see, but it's going to get even better 2 to 3 months down the line. So I'm next going to go ahead and inject the other side, and then we'll show you the final result. So we're here immediately after our vampire breast lift procedure with our patient here, and you can still see some of the redness from the injection. That's normal, but we can see her in her clothes now, and we can definitely see the projection and cleavage that it has formed, and the roundness at the top of the breast and towards the middle of the cleavage. So I think I'm very satisfied with this result. As mentioned, this is theoretically we believe to be a permanent result because the growth factors are going to take over and start to work in 2 to 3 weeks and really reach its maximal effect in about 2 to 3 months, and that's going to cause her own breast tissue to grow. So right now we're seeing the filler effect, which is temporary, which looks nice. That will go away, but in about 2 to 3 weeks, the growth factors will grow her own breast, and then her breast will be permanent in this position. And I think she'll be a really happy customer at that point. Yeah. Have any comments or anything?
I just like how it didn't take long. It was like 20 minutes. I could come in for my lunch break and just want injections for the weekend. And yeah.
And look great. Yeah. Well, thanks.
I like them. I love them. Thank you so much.